Welcome. This is Dr. Thomas Purtzer, continuing our ongoing discussion about the use of opiates in the treatment of chronic painful conditions. There's some very important terms that patients need to be familiar with if they are taking opiates to help in controlling their chronic pain, and we're going to discuss these terms. I'll mention them and then we'll discuss each of them separately. These terms are the terms of tolerance, habituation or dependencies, withdrawals, pseudo-addiction, and addiction. We have a at our website we have a handout that explains these concepts in detail, and this is a bulletin that was put out by the American Pain Society working in conjunction with the American Academy of Pain Management. The term tolerance implies that as a patient utilizes an opiate, they will require more and more of the medication to get the same effect. In the past, we used to be concerned that patients would develop tolerance to the point that it would be impossible to provide them with a dose of pain medications that would relieve their pain. The image that I've shared with patients many times is that we were taught that patients would become so tolerant to the use of opiates that they would require wheelbarrows to carry around the number of pain pills that they would have to take a day to control their chronic pain. Fortunately, this has not been the case, and many patients are able, although they do develop some degree of tolerance, are able to control their pain with a steady dose of opiates over long periods of time. When patients have never taken pain medications for any period of time, in particular not for less than 2 months, they're called opiate naive patients. A patient that is opiate naive will be very amenable to the effects of the opiates. It's somewhat similar to a person in their drinking of alcohol. When you first drink alcohol, you could become tipsy very, very easily. But as you drink alcohol for any period of time, it takes more and more for you to become intoxicated. Opiates are similar to a degree, but in my experience, most patients will start out at a certain dose, and then over the ensuing 3 to 6 months will escalate their dose somewhat, but generally not to a startling degree. They will then plateau in their use of the opiates and may stay at a certain dose of opiates for quite some period of time. They then may have either a worsening in their condition, or may have an acute accident, or they may become tolerant at a later date to the effects of the medication and require an escalation of the dosage. Generally, however, this escalation of dosage is not an infinite increase in the amount of opiates. I have limits to the amount of opiates that I will prescribe, and generally it will not prescribe more than 200 milligrams of morphine a day to a patient with chronic non-malignant or non-cancer related pain. I tell all patients that I prescribe opiates to that if they take them for over a 2-month period of time and they take them on a daily basis, that they will become habituated to the medications or become dependent upon the medications. What this means is that if they suddenly stop the medications, that they will experience withdrawal symptoms. These withdrawal symptoms can best be described as a bad case of the flu. If a patient has been taking, say, oxycodone or morphine for several months and they run out of the medications or decide to abruptly stop the medications, They will, after about 24 to 48 hours, start to become ill and feel like they have the flu. They will have a deep aching throughout their body. They will feel nauseated. They will feel quite drowsy. They'll have very poor energy. They'll have lots of diarrhea, and they will basically just feel like they have the flu. Depending on what type of medication they're on, these withdrawal symptoms will last anywhere from 3 to 7 days, and then generally the patients are off of the medications. Withdrawal symptomatology and dependency is not unique to opiates. Patients that take antidepressants become dependent upon those. Patients that take tranquilizing medications such as Valium become dependent upon these medications. And patients that take high blood pressure or heart medications are cautioned to not suddenly stop their medications, because they too are dependent upon these medications and can experience sometimes even fatal withdrawal symptoms. The next concept that we wish to discuss is the concept of pseudo-addiction. I've had several patients come to me and feel that they are addicted to medications. And I ask them why they are of the opinion that they are addicted to the medications, and it's because they have been told by a physician that they are addicted to the medications. Now, addiction, the short definition of addiction, is continued use of a substance or activity without medical benefit, despite the fact that it's harming you. Patients with pseudo-addiction are given pain medications by their attending physician and told that they can only take, say, 4 pain pills a day. The patients learn that in order to control their pain, they need to take 8 pain pills a day to control their pain. When they go back to the physician, and the physician finds out that they've used 8 pain pills instead of 4 pain pills, the physician makes the diagnosis that the patient is nothing but an addict, and abruptly discontinues the use of the medications, and the patients will go through withdrawal. This phenomena of withdrawal will be touted as further evidence that the patient is nothing but an addict, despite the fact that the patients report that they're taking the medications for a medical purpose to relieve their pain and suffering, not for a recreational purpose, despite the fact that the patients report that when they take an adequate amount of the medication, they have excellent relief of their pain symptoms. The patients are still labeled as an addict. Many of these patients are not addicts, but merely patients that are suffering from a pseudo-addiction, which is caused by underprescribing or inappropriate prescribing of the medication to control the patient's pain symptoms. These patients, when they're placed on the appropriate medications in the appropriate dosages, do not have addictive characteristics. They use the medications appropriately, they have excellent relief of their pain, and they do not overutilize the medication. They will become dependent upon the medication, as almost all patients do that take them for any period of time, but they can generally be very easily weaned off of the medications if that is required. So it's very important that you, as a chronic pain patient, educate yourself about these concepts, the concept of tolerance, of dependency, the withdrawal symptomatology that you may suffer if you stop the medications suddenly, and the concept of pseudo-addiction and addiction. I ask all of my patients to never run out of their pain medications and to never abruptly stop their pain medications. I do not want anyone to have to go through with withdrawal symptomatology. We can wean every patient off of the medications if given enough time and the appropriate management. These concepts are, as I mentioned, have been defined in detail by both the American Pain Society and the American Academy of Pain Medicine, and a document is available on our website in regards to these very important concepts. If you have any questions about these concepts, be sure to ask me, and I'll be glad to answer them. Thank you for listening to this series on opiates in pain management.